Boy, I've had a few technical difficulties today, but we are here. We are live. So, welcome to Lisa Moss Medicare. I've put these shows together for you every week, 12 noon Mountain Time. Not, yeah, 12 noon Mountain Time. Sorry, I got a little scuffled today on my going live. I'm new at this technology, so bear with me here. But I will give you all the information so you can make an informed decision for you on your Medicare. Remember, you're the consumer. Now, I don't work for the federal government. I don't work for Medicare. I'm a licensed agent. In my area of Idaho, I'm licensed with almost all the different companies. I don't know if you knew this or not, but Medicare is done by county and it's done by state. So if you move to a different county, a different state, there's a really good possibility you're going to have to change your Medicare plan. If you're on a supplement plan, you change your Part D plan, not necessarily your supplement. However, if you are on an F plan and a supplement, you're probably, I can almost guarantee you that you're paying too much. So that's a good reason to connect and contact me, and we can look at all the options in your area. If I'm not licensed in your state and your county, I will find somebody that is great that can help you in your area. Now, the way to reach me, I'm going to put on the screen here my information. You can reach me at 208-544-5011. You can also write comments. Today, we are streaming live for the first time ever on YouTube and also on Facebook. So you can write comments and I will contact you back within this technology today, or you can reach me at 208-544-5011. Today, we're going to go over something really special for you, is how to possibly save some money on your Medicare prescription plans. Now, that is if you have a standalone policy, you're on a supplemental with a standalone, they call it Part D drug plan, or if you're on a Medicare Advantage. Both of those have what's called formularies, and that's how much they charge you for your prescription drugs. On your Medicare Advantage, you're probably paying some copays along the way. If you're on a standalone drug policy, you may or not pay copays. If you have some extra help, you may or not pay copays. It depends on your particular plan. It's really important every year to check in with your agent. You can call me if you don't know who your agent is, or you can always call me anytime anyway to check in on your policy, because as of next year, we're probably going to see more and more changes on your prescription drug cost and on your prescription drug plan. When they did the Affordable Cares Act back in 2020, they changed your prescription drugs, your donut hole. We'll talk a little bit about that today, to get smaller and smaller. And as of 2025, they're going to eliminate that. So we suspect that your drug policies will probably get more expensive. However, it'll cost you less at the pharmacy to purchase your drugs. We'll see how it goes as of next year in 2025. We'll know in October. So check in with us definitely in October. So we're going to go over 10 things that can help you today with your prescription drug plans and saving some money. The first one is to make sure you choose the right plan for you. October 15th through December 7th is the time that you can choose your drug plan. It's either combined together in your Medicare Advantage. Your drug plan is usually included with that, or you have a standalone drug plan. So you want to check in and make sure those formularies, whatever drugs you're on, because everybody's different, right? Whatever drugs you're on, that you can get the least expensive drug plan for the drugs that you're on. You know, for instance, somebody that's on Ozempic, which is a diabetic drug, is usually going to pay about the same price across the board. But we're finding some companies now are making you go through an extra step and getting prior authorization because they're using it also to control weight. So there's all these little nuances that your agent can help you with that could possibly save you some money. So choosing that plan is very important. Number two, You can use preferred pharmacies. If your plan allows you to have preferred pharmacies, usually there's 4 or 5 of them in your area, depending on how big your area is. Sometimes there's more, sometimes there's less. Those preferred pharmacies a lot of times will charge you less than a non-preferred pharmacy. So check in with your plan. You can call on your card. You can call the benefits center on your card directly, or you can call your agent and they can help you find out what are the preferred pharmacies. Number 3, you might also consider the mail order pharmacies. A lot of times they're less expensive. Instead of giving you a 30-day supply, they'll give you either a 90 or 100-day supply. So a 3-month supply of medications, and a bonus, it's shipped right to your house. So if you don't travel a lot and you're at home and you can get your pharmaceuticals at your house, that may be a way to save you some funds by doing a mail order pharmacy. Number 4, ask about generic drugs. A lot of times people have been on drugs for quite a long time and they don't understand or didn't realize that there's a generic that can be possibly the same drug, just generic after it's been out on the market for a certain amount of times. The pharmaceutical companies may offer a generic prescription, and generally those are at no cost or a lot lower cost than you're already paying. So ask your doctor about that. Is there a generic for the exact prescription that I'm utilizing? All right, number 5, you can apply for extra help. If you have a limited income and limited resources, the state and the federal government both have programs that you can apply for extra help. Low income subsidies are what they're called. They have state subsidies and they have federal subsidies, and some people even can apply for both. They are limited. Some of the policies that they have, you have to make under a certain amount of money per year, almost all of them. So you need to check in with your representative, or you can go online at medicare.gov and look at that. You can also go to your Medicaid office that is in your town. If you're in a larger town, you can go to that and just check with them and say, hey, I make under X amount of money. Usually it's under $1,800 per month and under $16,000 in assets. Generally your house, your home that you live in, your car, any burial expenses up to about $1,500, and your burial plots aren't included. All your savings would be included. Your stocks and bonds would be included. If you had extra homes, would be included. So again, you can check in with your agent, or you can check in with Medicare.gov and see if you can apply for extra help. That will help you with your prescription drug cost. 6, you can review with your doctor. Usually you go see your doctor once a year, sometimes more. Review your medications. A good example is I had a gentleman, he was a vet, and he wanted to see if it was less expensive to go to the vets for his medications or less expensive to do a Medicare Advantage plan. So we compared them. He was on more prescriptions than I've ever seen anybody. It was over 20. And some of them were for the same thing. So he just kept adding prescriptions over time. So you can go to your doctor and say, hey, do I need all these medications? Are there other alternatives that I can use besides these medications? Review your medications every year with your doctor. You may be surprised. You may be able to save a little bit of money on your medications with your doctor. So that's a good thing to do, is review every year. Number 7, you can check the manufacturer discounts. The pharmaceutical companies a lot of times will offer discounts on their own pharmaceuticals. Why? They want you to stay with their company versus another company. So sometimes they'll give you discount coupons. Your doctor will know. And if not, your pharmacist a lot of times will know if there's discounts on that particular pharmaceutical that you're using. Number 8, consider therapeutic alternatives. Now this one, it's a little out of the box. However, there may be some alternatives that you can do, such as acupuncture, maybe some physical therapy. You can talk to your doctor again about this and see if there's some alternatives that maybe you may be able to lessen your medication so you don't pay as much, maybe even get off a medication. You may be able to change your diet and do some nutritional counseling. There are alternatives that you can do. So you could check in with that. You could check in with your doctor and see if what alternatives are available. All right, number 9, you can use state pharmaceutical assistant program. Now, each state is different. Again, if I'm not licensed in your state, I can find you a representative to help you with that. Again, my number is 208-544-5011. And these state programs, you do have to qualify for them. And usually you can't be on Medicare or Medicaid. I know for the state of Idaho, you have to be 151% to 200% of the poverty level. There's a lot of requirements for these. However, you might be able to qualify. So each state, there's different requirements. I can't go through each of the different states, but I can tell you the state pharmaceutical assistant programs may be a good alternative to check in. So you can, again, check with your agent, or you can even Google, it's SPAP programs within your state for Medicare. The last one, number 10, be aware of the donut hole. Probably do a whole show on just what is the donut hole. Basically, if you're taking pharmaceuticals, after you go over a certain amount of money that you've paid into pharmaceuticals and out of pocket, you go into what's called the donut hole. Generally, it's around $3,000 to $4,000 that you're spending out of pocket. Once you go into the donut hole, you spend more out of pocket. You're going to spend about 25% of the cost of the drug. And again, that's the time to ask for some extra help. I know here in Twin Falls, Idaho, our hospital actually has a program that you can apply for to get some extra help from the pharmacy at the hospital itself. So be cautious of the donut hole. If you can do some of these other things and get mail order drugs, or check with your doctor, maybe getting on some generic drugs, so you don't spend as much out of pocket to begin with and not go in the donut hole, you certainly will save some money. Once you're in the donut hole, you're going to pay a lot more. You're in the donut hole for a certain amount of time of money out of pocket. Then you get to the catastrophic level and you generally don't pay anything out of pocket at that point. But it can cost you quite a bit once you get into that donut hole. So you want to see what you can do to make sure you don't get into the donut hole. I just got a comment that came in. Let me show it to you online. It says, why do they call it the donut hole? It doesn't make sense. Well, if you think about a donut, it has a hole in the middle of it. So you're paying X amount of money out of your pocket at this point, and then you go into this hole. It's like a black hole that you actually pay a lot more money out of the pocket once you go into that. So I know people that have gone into it, they know that they're in it. You're going to go to the pharmacy, say now you're paying a copay of $11. Your copay may jump up to $75 or $100 for that drug while you're in that hole. So you want to just see what you can do to save drugs before you get to that point. There's a lot of different ways to do that. Again, reach out to your agent. Whoever your agent is, they can help you with that. If you don't know who your agent is, if you don't have an agent, if you want to change agents, you can always call me. I'll put, again, my number on the screen for you. Here it is, 208-544-5011. You can call me directly. I'm happy to be of service to you. I also want to say thank you for being here today. I really appreciate it. Again, call me. You can also go to my website, which is insuranceover65.com. You can email me through my website at any time and ask questions. So again, I'm here for you. I want to make sure that you have the proper education in your Medicare. You're the consumer. You've worked all these years, 65. If you're over 65, you've worked a lot of time to get this Medicare. So you're the consumer. Make sure you're in the right plan. And if you're not, give me a call. 208-544-5011. Thank you. Have a great week out there. Bye-bye.